Diagnosis 101 – Your Guide to Wellness. Acute cholecystitis is a condition characterized by the inflammation of the gallbladder. The gallbladder is a small organ located beneath the liver that stores bile, a substance produced by the liver to aid in the digestion of fats. Cholecystitis occurs when the bile becomes trapped in the gallbladder, leading to the growth of bacteria and causing inflammation. Acute cholecystitis causing severe pain in the upper right side of the abdomen. The pain may radiate towards the right shoulder or back. Other common symptoms include a sharp pain in the upper right-hand side of the abdomen, which can be accompanied by bloating, food intolerances, especially to greasy foods, and ongoing discomfort. It is important to note that the symptoms of acute cholecystitis can be acute or chronic, with acute cases presenting sudden and intense pain. If you are experiencing these symptoms, it is recommended to seek medical attention for proper diagnosis and treatment. Treatment options for acute cholecystitis. You may not be allowed to eat or drink at first in order to take stress off your inflamed gallbladder. Fluids through a vein in your arm. This treatment helps prevent dehydration. Antibiotics to fight infection. Pain medications. Procedure to remove stones. Gallbladder drainage. When discussing the diagnosis of acute cholecystitis, one of the primary approaches is taking a thorough medical history and conducting a physical examination. The patient's symptoms, such as severe abdominal pain, tenderness in the right upper abdomen, and a positive Murphy's sign, can provide crucial diagnostic clues. In addition to the clinical assessment, imaging techniques play a vital role in confirming the diagnosis and assessing the severity of acute cholecystitis. One commonly used imaging modality is ultrasound. Ultrasound can help visualize gallstones, thickening of the gallbladder wall, and the presence of pericholecystic fluid, which are indicative of acute cholecystitis. It is a non-invasive and readily available imaging technique, making it a preferred choice for initial evaluation. Another imaging technique that can be employed is computed tomography, CT, scan. CT scan can provide a more detailed visualization of the gallbladder and surrounding structures, allowing for a comprehensive assessment of the condition. It can help identify complications such as perforation or the presence of abscesses, which may require immediate intervention. In some cases, magnetic resonance cholangiopancreatography, MRCP, or hepatobiliary immunodeacetic acid, HIDA, scan may be utilized to further evaluate the gallbladder and biliary system. These imaging modalities can provide additional information on the presence of gallstones, biliary ductal dilatation, or any obstruction in the biliary tract. It is important to note that the choice of imaging modality may vary depending on the availability of resources, the severity of the patient's condition, and the preference of the healthcare provider. Each imaging technique has its advantages and limitations, and a decision should be made based on the individual patient's circumstances. In conclusion, when discussing the diagnosis and imaging techniques used to diagnose acute cholecystitis, a comprehensive approach combining clinical assessment and appropriate imaging modalities is crucial. Ultrasound, CT scan, MRCP, and HIDA. Diagnosis 101. Stay curious, stay informed, and stay healthy.